Hey guys, it's Dr. Justin Southall, Eastern Shore Chiropractic and Sports Clinic. Today I'm going to show you something a little different than what we've been doing in the past, our educational videos. Today we're actually going to show you a live treatment and to show you why people come here to Eastern Shore Chiropractic. So come on in, we're going to invite you in, so come on this way. So as you walk in, you're going to see we have a nice comfortable waiting area. Our office staff that is there taking care of patients already. And you're going to follow me in right through this door. And as we walk in, we've got Vanessa right here already being treated by our soft tissue specialist, Chase. So what he is doing is he's working with Vanessa because she sits basically at a computer all day long, working on advertisements, working marketing, just being in front of the computer, and her posture has really regressed from doing that. So I'm going to let Chase kind of explain to you why these patients are coming to him and to coming to us to get better and why we get such good results so quickly. So go ahead and tell them what you're doing, man.
So what I'm doing here is a little bit of fascial distortion. So typically what we see, and this happens all over the place nowadays, you've got people working on the computer, looking at their phone, and all day we're like this, we're looking like this. And so what happens is these muscles in the back, they get all stretched and lengthened and weak, and the body starts forming adhesions to try to strengthen things back here and hold it together. The body kind of freaks out a little bit. So what I'm doing is I'm working on clearing all that out. And as we clear it out, her pain should diminish, and her range of motion should also increase. After we finish clearing things out like this, we'll also give her some homework to do. We'll work on some stretches to stretch this stuff out so that she can actually get to a good place where her posture can line up perfectly. So that's where we're at now.
Awesome. So Chase and myself and a new employee that we're going to introduce to you soon, we specialize in fascial distortion model and active release techniques. So right now he is mainly doing fascial distortion. Active release is fantastic as well. We're able to get pain decreased usually in the time that they're in, and she's not getting adjusted first, she's actually getting released first, and it's going to allow her to hold the adjustment better, and it's going to allow her to let the muscles to activate better with the exercises that we'll show her, as well as when we taper at the end, it's going to pull her posture and just going to help to re-educate those muscles. So as he's wrapping up with her, we're going to go into, I'm going to show you how we're going to do some dry needling in today's treatment, and I'm also going to adjust her, and we'll do a traditional chiropractic adjustment. But for those patients that are kind of freaked out or scared of getting a manual adjustment or that snap, crackle, and pop effect, we also utilize the instrument, which is amazing. It's high tech, it uses a gentle percussion, and a lot of our patients love to use it just for the ease and comfort of it. So we're going to go ahead and dry needle her. My hands are clean. I did not get my gloves out, but that's okay. All of her main amount of her pain is all through this left trap. And so she's sitting there looking to the right all day long and looking forward, and she's moving her around now. But she's got some monster knots in here that Chase has already broken up and freed up. But what we're going to do is we're going to take this little small needle here, if I can get it in, and we're going to go right into this trap here. And I know you've seen me do it on Chase before, but this is a real case scenario, and I'm just working into that muscle right there. Basically, is that painful?
No.
Okay. Sometimes it's a little painful if we hit an area where the muscle's been bound up and really tight for a long period of times. It can cause that muscular twitch, and that's the reaction that we're looking for. And sometimes it's a little bit painful, but for the most part, the type of dry needling that we do is much more gentle. You have any headaches, any pain up through the neck?
Sometimes.
Okay. So we're going to do one more needle just based upon time. If I can get that in there. There we go. Did you feel that? Mm-hmm. So we just had a really good twitch reaction response right here in that levator as it's coming right off the angle of the scapula here, going right up in here. And that's the type of response that we're looking for when we're dry needling. And she's already kind of like moving her shoulder around because she feels something a little different, which she hasn't had because this is only our second treatment. We hadn't needled her yet. So I'm going to go ahead and take the needles out. Again, for time, these will stay in a little longer during one of our treatments. But I'm going to go ahead and take them out and go ahead and just move that head and neck and see how it feels now.
A lot looser.
A lot looser already. So I'm going to show you two adjustments that are traditional chiropractic. One is going to be just a traditional cervical adjustment. So I'm going to have her lay on her back. And we've already done a complete examination. We already have our x-rays. We know what we can treat and what we can't. So I'm going to get in here and find out where she's out. And I'm going to put a little pressure, and you may even hear the adjustment as it goes off. So let's just relax that. Relax all the way. Drop that leg down for me. Very good. And one more little bit. Good. Excellent. So our left side was really, really jammed up. We got a huge release. The right side was just a little out. I'm going to recheck the alignment, make sure it's really good. And so she's moving really, really well now. So we're going to do one more because that shoulder's giving her such discomfort. We're going to do a rib adjustment. And everyone, when I say you got a rib out, they're always like, how do you get a rib out? I thought the ribs were down here. Well, the rib cage expands from T1 all the way down to T12, and it wraps around to encase your organs. And every time you breathe, they're moving in and out. And what will happen is the rib in the back, as she breathes in and inhales, it can pop out of place and be just like my finger here. And I'm going to just gently put it back in place. So I'm going to do a little anterior adjustment first. Sit up for me. Lean back, blow it out. And that, how was that?
Good.
Good. So scoot down about 6 inches. And we're going to get that rib that has been nagging at her, kind of the area Chase has been releasing, and we're going to get it to feel better too. So lean back, move it out, a little bit more. There it goes. Perfect. So I don't know if you heard that, but it went right in place. Go ahead and move it. See how that feels now?
Way better.
Way better. So pretty crazy. You just saw a brief. This is just a kind of tidbit of what we do and why people like Vanessa that have sit all day long, they need to come see us. You need to come see us. Give us a call, 251-990-8383. We are your fair chiropractor. We are Eastern Shore Chiropractics.com if you're trying to find us on the web. And remember, it's your life. Live it in health.